Settle into life in a pandemic, very little comes as a surprise anymore. No question can be asked too many times, and the answers can change by the day or even the hour. Because we're always learning new things about this virus. And as we start the rollout of vaccines for the public, we're going to learn new things each day about how to make the process smoother. That's why tonight we're answering all your questions about the vaccine, what we know, what we don't know, and what progress is being made as we work with each other for a brighter future ahead. We together, a coronavirus discussion.
And thank you for joining us tonight for our special, where our goal is to answer all of the burning questions that you have about coronavirus. I'm Molly Pat. Tonight I'm joined by Governor Laura Kelly, who is at the State House tonight, and Dr. Sri Dhanapudi from Stormont Vale Hospital, who is in our studio. So thank you both so much for joining us tonight. We do have a lot to get to, and our time together really goes fast. So I want to first update everybody on the latest numbers and trends that we're seeing right this minute in the state. So first, a look at the numbers in Kansas. More than 272,000 people in the state have tested positive since the pandemic started. More than 3,000 people in the state have died from the virus, and right now 708 people are in the hospital fighting the virus in Kansas. And according to the CDC, Kansas is ranked 41st for how quickly it's administering its vaccines compared to other states. In total, the state has administered over 151,000 vaccines, and Kansas has been given more than 348,000 vaccines, which puts the state in 37th for the amount given to Kansas as a whole. So we want to get right to it tonight. I'm going to start with Governor Laura Kelly for this segment, and then we'll check back in with Dr. Dhanapudi in just a minute here. So first, Governor Kelly, looking at those rollout numbers from the CDC, why is there such a big difference in the number of doses given to Kansas versus how many have been administered? Samuel Bauer, for example, asked, does that mean that the available units are in a distribution hub waiting to be administered to people or distributed to counties, or where are those doses at?
Well, part of the problem we have here, Molly, is that the CDC puts the doses given in their database as soon as they ship those out of the factory. So those are the numbers they've got. The numbers that we have are the numbers that have actually arrived here, been distributed out to our counties, and get into arms. So that's why you have the discrepancy with the numbers. So, do we know that, we need to provide these vaccines as fast as we get them and to as many people as we can? Yes, we do. And we've got a system set up to do that.
And so do you think that the state is getting adequate vaccine shipments?
Oh, no, absolutely not. There is a vaccine shortage actually all across the nation and the world. And so, Kansas is suffering as a result of that with a vaccine shortage. So we're not getting as many as we need, but what we are getting out and we're getting into arms. We just moved into phase 2 so that we've got about 1 million people in Kansas now eligible to receive the vaccine, and we are dispensing the doses as quickly as we possibly can. We are looking forward to some changes at the federal level that we think will increase the number of doses that we get. So that's where we are right now. We're doing everything we can to get those doses out of the factory into their counties and into the arms.
And so Kathy Allison sent us a question. She wants to know who decides how many vaccines each county in Kansas receives, and how is that number determined?
Yeah, it's a sort of a complicated algorithm that we use, but we take into consideration, obviously the population of the county. We take into consideration the outbreak, the severity of the virus within the county. We take into account their ability to get the vaccines out and into arms. So all of those kinds of things go into this and into a complicated algorithm, which is run on a regular basis. As soon as we know how many doses we're going to get from the federal government, we put that formula into place and determine where to send those shipments when they get here in Kansas.
Okay, so like you said, as a reminder, we did just move into phase 2 of the state's vaccination plan, which means anybody 65 years and older are up to get the shot, along with high contact critical workers like firefighters, police officers, grocery store employees, also K through 12 staff, and then people who live or work in congregate settings like homeless shelters, child care, emergency shelters, or correctional facilities. They're also in phase 2. So Governor Kelly, with that, Kathy Gilbert says, my elderly parents live in Coffee County. The county health department nurses refuse to administer the vaccine. What is the elderly supposed to do that reside in this county, and why are these nurses allowed to refuse their duties in which they have committed to do? So what should people in the county do, and does something like this put the state behind in a vaccine rollout plan?
Well, in the situation specifically in Coffee County, I believe that they are using contract nurses, nurses who have agreed to come in and provide the vaccinations for the residents of Coffee County. So I think that's how they've addressed it, and so I would suggest that elderly folks in Coffee County just call the local public health department, because I think that they have fixed that, and they have people there now to vaccinate.
Okay, another viewer question from Lindsay Newton tonight. She says, when are Kansas public school teachers and licensed daycare providers expected to receive the vaccine?
Well, the school teachers are in the phase 2, and so it'll be up to the local counties health departments to determine how they're going to prioritize the folks who are in phase 2. So, they're 65 and older, they're high contact workers like teachers, like meatpacking plants workers, and folks in congregate settings. So, we provided the guidelines and recommendations. When it gets to the local county health department, they'll actually determine who will go first within that phase.
Okay, Governor Kelly, so we have, the phase and the guidelines like you say, but I think the trend going on right now is that, you could be listed in these phase groups, but you're still confused about when, how, and where you'll get the vaccine. Brenda Haney is a middle school teacher who emailed us saying that she is beyond frustrated with being in phase 2, signing up with the county, the hospital, and even pharmacy vaccine lists, only to be told nothing then. So how do you respond to the confusion and really uneasiness that people are feeling? Okay, I know that I'm in this phase, but I have no idea who will contact me, where I go. So you get this hope of I'm coming up, but then you have no idea or direction of how to see it through.
Well, I feel for her. I understand the frustration that some folks have. I tell her not to give up. The local county health departments really are the ones who will orchestrate this at the local level. I saw some Facebook exchanges today in one county. A person had the same problem. They had made the contact. They'd actually signed up for an appointment and had heard nothing. It was recommended to them that they go call the county health department or go look at their hospital e-chart, and indeed that's where the appointment had been made.
Okay, so then on that same tune, what about people who don't know where they fall into the phase plan? They just don't know which phase they belong to because it's not listed, or they just don't know who to turn to ask.
Well, there's some pretty detailed information on the website, kansasvaccine.gov, so they might be able to get their questions answered there. If they can't, then again, they need to call their local health department, because the local health department will be able to tell them whether or not they fit into any of those eligibility slots.
Okay, so in phase 2, that includes our elderly, obviously. We've taken some viewer calls where people are concerned about how those folks will get to the vaccination sites. A lot of them have been hunkered down for 10 months just waiting for this moment, but now some can't or really don't want to leave their homes to go into the public to get vaccinated, even though they still want a vaccine. So is there something that you and your team have thought about doing, and any arrangements that can be made for those people?
Well, there are a number of spots that we have actually dealt with the elderly, particularly those in our nursing facilities, where we are taking those vaccines on site rather than expecting that those folks are going to be coming into a vaccination location. So we've been able to deal with it particularly for those living in the congregate settings. For those who are living in their homes, I would suggest that they call their public health department and see if there are arrangements being made to provide any sort of what these folks might consider a safer environment. And then two, I would also call their primary care physician who could be signed up as a provider.
And so, you know, some people are calling us and saying that they try to call their local health department and their primary care physicians, and then they respond saying, you know, we're waiting on the state to get more information. So, you know, walk us through that communication timeline, because I think that's what people are really starting to get frustrated with. You know, they just want to know when they're going to get the vaccine. So what is the communication process between your team and the local, on the local level?
Yeah, we have really addressed that issue significantly over the past week in particular, and we have now provided it's an online manual for our local health departments and providers, so that they can go there and get all of the information that they can possibly need and more. And obviously gives them contact numbers should they not be able to interpret some of the information that's given there. But we recognize that we have got to have really seamless communication going on between the state and our local partners. It's the only way it's going to get done.
Absolutely. And so we've also been taking a lot of questions from salon owners and salon employees. They feel like they were at the front and center when the pandemic started, when businesses were being shut down and then had to adjust to several restrictions. They were specifically named to close and then be given limitations when they were able to reopen. But now some of them feel like they're forgotten because they're not listed in a phase for a vaccine. So what do you have to say to them and others who may feel that way too?
Well, you know, when it comes to folks working in various businesses, you know, there are some who are eligible right now in phase 2. And that's what they need to go check that out and see if they might fall into a critical essential worker level, like a meatpacking plant or a grocery store, or you know, others that have been designated that way. But again, you know, if they have a question about it, they've got to call their local public health department, because they're the ones who will go right down the list and see if they fall into the phase 2 essential worker category.
And so salon owners may really fall into that essential worker category.
It probably would depend upon, you know, how large a salon it is, and, you know, other factors like that. But, you know, again, you know, all of that is being left really for, you know, while we are providing the guidance and, you know, in constant communication with the local public health departments, they're really the ones who will determine whether specific folks fall into the definition of that essential worker.
Okay, so switching gears to unemployment for just one question. Anthony Mall says that he cannot get through to the call center, and when he can, he feels like his questions aren't being answered. He says he hasn't seen any money since December 12th. So what can people do to get their questions answered, and is there anything being done to make the system easier for people to get through and really talk to somebody?
Now, you're talking now about labor?
Yes, just real quick for one question.
Is that what I heard you say?
Yep. Is there anything that people can do to get through to the call system for unemployment?
Well, you know, there's also an opportunity for them to go in online rather than on call, you know, using the phone. And I suggest that they do that. If they've not had any success calling in, then I suggest that they go in and use the website.
Okay, and do you know if the $300 payments started going out today? I know we talked with you about that last week too.
It is my understanding that they are going out this week.
Okay, good to hear there. So, you know, many governors across the entire country and even local health leaders too have been dealing with a lot of negativity through the pandemic, especially as it keeps going on. So what do you say to people who may, you know, be upset with you in this state going through this pandemic? What do you want them to know that your team is doing right now?
Well, I want them to know that we understand the frustration. You know, we share some of that frustration. You know, my just knowing that, you know, there are 1 million Kansans right now eligible for vaccines, but we don't get any more than 30,000 doses per week. The additional ones we get are generally for the second dose for folks who had already been vaccinated once. So, that is frustrating. And I am hoping that, with the implementation of the Defense Production Act that President Biden signed earlier this week or late last week, that we will see the ramping up of vaccination production or vaccine production so that Kansas will get more and we'll be able to get more out to the folks and get it into the arms. So, that's not going to happen overnight. It takes time. We also know that we need more types of vaccines. Right now we've got the two. We've got the Pfizer and the Moderna. AstraZeneca has not yet submitted the paperwork they need to come on board as a third vaccine. We're hoping that will happen very shortly, and then that will increase the number of vaccines that we have available for folks. So I just need to ask for patience and understand that we are doing absolutely everything that we can, and that we will do everything we can to keep people informed, to keep local public health departments informed, and be as transparent about this as possible. I want to reassure people, though, that one of the rumors that's been out there is that we're holding back vaccination or vaccines, or that we're not getting this out. Trust that the minute they come into Kansas, we're getting them out to the providers.
All right, Governor Kelly, thank you so much for joining us tonight and answering all of our questions. And when we come back, we're going to check in with Dr. Donna Pudi to answer more of your questions. We'll be right back after this.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
All right, welcome back to our coronavirus special discussion tonight. We just talked exclusively with Governor Laura Kelly, and now we're going to talk with Dr. Donna Pudi from Stormont Vail Health. So thanks for sticking around for us tonight. First, let's kind of just talk about, we just heard from the governor. You were here and you were listening to what she was saying. How are you reacting to, her answers tonight and the communication process that's been going on between all of you?
So with Stormont, we're at a little bit of an advantage because we've been one of the pre-position sites, the 5 sites of health systems kind of across the state that were part of the very early discussions as they were, as KDHE was deploying vaccine to the health system. So we've had weekly calls for a number of weeks now, and so we get a little bit more information perhaps on the front end, but I know they are also doing weekly calls more broadly with other health systems. So I know they're working very hard to get the information out, but there's a constant glut of new information and constant pivots and changes. So it's really hard to keep everybody in sync as we're trying to get that information disseminated.
Yeah, and safe to say that it really is just a learning curve of everybody working together on that front.
Absolutely. She mentioned a number of times the local health departments, and KDHE really provided the broader guidance. So the state kind of provided the broader guidance about the phases and allowed the flexibility for the local health departments to provide direction regarding sub-prioritization as our vaccine mounts. As she said, there's 1 million eligible people in phase 2. We can't tackle 1 million people all at once. So being able to break that up into more manageable, smaller chunks. And also providing the latitude if a particular county is able to move through their eligible people, that they can go ahead and move forward and not be held back by needing state direction to move out of that particular phase. Advantages and disadvantages to that approach. So theoretically, at least, you can understand how they aligned around that philosophy and providing that latitude to really be able to determine at the local level what's most appropriate and what's needed. Some of the challenge comes about in that you have a lot of variability in the local health departments and their infrastructure and how ready they are to help direct and guide such an effort. So that can lead to some challenges as well as variability kind of across the state that I think a number of us have some concerns about how that'll play out longer term.
Absolutely. Okay, so I want you to talk now about how Stormont Vail plans to reach out to their patients 65 and older to schedule vaccinations right now. Yeah,
so I need to say something up front first in that the health systems right now are not receiving any direct allocation for phase 2. That means vaccine is not being earmarked to ship to the health systems, either for additional own use or for being able to participate in the community efforts for vaccination. So it's really up to the local health departments who are receiving all of the vaccine for that county to determine how they're going to redistribute to any other vaccinators within that county. In our particular case, we've been having close conversations with Shawnee County and Grace Med and University of Kansas St. Francis really for a number of weeks, really since kind of before we'd even received any vaccine, about how we were going to take on this effort. So due to that collaboration and the fact that Pfizer, as we know, has some particular constraints around how you have to manage it due to those ultra cold temperatures, the Shawnee County has directed their allocation, the county's allocation, to be stored by us and by St. Francis as we help to administer to the 65 and up group. So really we are subject to the direction and the control of that vaccine from Shawnee County. So given the small amounts of vaccine that we have to work with right now the information that we're getting is that we will receive anywhere between 1,000 and 2,000 at most a week. So we're really working through how do we sub-prioritize, and that's not that anybody is any lesser priority than anybody else, but it's going to be nothing but frustration if we extend invitations to 60,000 people for 2,000 vaccines. And it'll shut down our system in terms of our scheduling platform.
Yes.
So we received our first allocation from them for the public on Friday.
Okay.
And then we started our vaccinations for the 65 and up group all day today and then a half day tomorrow. But our first invitations, we started with the 75 and up group because that was already 10,000 people in our electronic patient portal. So that was the easiest way to get people that
So you guys are looking at your patients and then moving on from there?
Yes.
Okay.
Yeah.
All right. Definitely makes sense. Okay. We're going to take another quick break here, but we've got one more segment coming up to answer more of your questions. We'll be right back.
We Together, a coronavirus discussion sponsored by Stormont Vale Health.
Welcome back to our coronavirus special discussion. We're going to get right back into it with Dr. Donna Pudi from Stormont Vale. So can you first explain what people should do or be prepared to do when they show up to get vaccinated? What should they bring? What should they be prepared to pay for?
So they should just bring themselves a mask, but if they forget their mask, we will provide them one on site. At least for our facility, we're able to do that. And some identification, basically something that has their date of birth on it so we can validate that they're part of the eligible group. And other than that, that's all they need to bring with them. You asked one more question, Molly. What was the second part of that?
Should they be prepared to pay for anything?
Oh, gotcha. Very important question, and I know that question comes up frequently. So if they have insurance, we will go ahead and bill their insurance for the administration fee. The vaccine is provided to us by the government, so there's no charge for that. If they don't have insurance, there are federal support dollars that we're able to use for that. So they should not, they would not be paying anything out of pocket.
On a day like today, you know, with the weather and maybe some cancellations of appointments, some people were worried about if, you know, down the line they're scheduled and then maybe it happens again, weather, and they miss that date to get their second boost. How protective is that first one, and what will that look like?
So they should definitely follow through in still getting the second vaccine as soon as they can get access to it. There's not a lot of data with respect to how effective just one vaccination is for the Pfizer or Moderna, but the preliminary data that we have only demonstrates about 50% protection, whereas the two-dose regimen gets you to about 95% protection. So even if they miss for some reason that recommended window for the second vaccine, the next time that they can get in, the next time they have that eligibility, they should definitely get it. We do go ahead and schedule them for the second vaccine when they come in, so we'll have a process too for getting them rescheduled.
Just to get it right on the books. You know, we know that thousands of healthcare workers, vaccinated healthcare workers, have been invited to the Super Bowl, especially with the Chiefs going in. So do you know if anybody from Stormont Vail has been invited?
I don't. That's a good question. I need to find that out.
Yes, hopefully so. And then another one about the vaccine, my last vaccine question. You know, if you're up in your phase and you say, no, I don't want it yet, do you have to wait until we get through to phase 5 to come back around and say, okay, I want it, or can you go back each time again?
Yeah, anyone from a prior phase is still eligible.
Okay.
So now we're in phase 2. Anyone who was eligible in phase 1 can still come in during phase 2.
All right, Dr. Donapudi, thank you so much for joining us. We appreciate you coming back week after week to answer all the questions,
Sure.
even on your daughter's birthday.
Yup. Happy birthday, Jana.
Yes, it definitely doesn't go unnoticed that you're using all of your free time to come here. So we truly, truly thank you for all of your time and effort with us. And thank you so much for watching tonight. We want you to keep sending in your questions as well as we continue to work at getting answers. We're going to keep doing this every Monday for a little bit here, so you can email all of those to coronavirus@ksnt.com. I am reading through all of the emails and using them right here every Monday night, so be sure to email those to us. Thanks for joining us. Have a good night.